Bipolar disorder is a chronic mood disorder that causes intense shifts in mood, energy levels and behavior. Manic and hypomanic episodes are the main sign of the condition, and most people with bipolar disorder also have depressive episodes. The condition is manageable with medications, talk therapy, lifestyle changes and other treatments. What are the types of bipolar disorder? There are 4 types of bipolar disorder, including 1. Bipolar I disorder. People with bipolar I disorder have experienced one or more episodes of mania. 1. Most people with bipolar I will have episodes of both mania and depression, but an episode of depression isn't necessary for a diagnosis. 1. The depressive episodes usually last at least 2 weeks. 1. To be diagnosed with bipolar I, your manic episodes must last at least 7 days or be so severe that you need hospitalization. 1. People with bipolar I can also experience mixed states, episodes of both manic and depressive symptoms. 2. Bipolar II disorder. People with bipolar II experience depressive episodes and hypomanic episodes. 2. But they never experience a full manic episode that's characteristic of bipolar I disorder. 2. While hypomania is less impairing than mania, bipolar II disorder is often more debilitating than bipolar I disorder due to chronic depression being more common in bipolar II. 3. Cyclothymic disorder, cyclothymia. People with cyclothymic disorder have a chronically unstable mood state. 3. They experience hypomania and mild depression for at least 2 years. 3. People with cyclothymia may have brief periods of normal mood, euthymia, but these periods last fewer than 8 weeks. 4. Other specified and unspecified bipolar and related disorders. If a person doesn't meet the diagnostic criteria for bipolar I, II or cyclothymia but has still experienced periods of clinically significant abnormal mood elevation, it's considered other specified or unspecified bipolar disorder. What is a person with bipolar like? Bipolar disorder is a mental health condition marked by intense mood changes. People with the illness switch back and forth from mania or hypomania, an emotional state of being energetic and gleeful or sometimes aggressive or delusional, to having episodes of depression. Causes. The exact cause of bipolar disorder is unknown, but several factors may be involved, such as 1. Biological differences. 1. People with bipolar disorder appear to have physical changes in their brains. 1. The significance of these changes is still uncertain but may eventually help pinpoint causes. 2. Genetics. 2. Bipolar disorder is more common in people who have a first-degree relative, such as a sibling or parent, with the condition. 2. Researchers are trying to find genes that may be involved in causing bipolar disorder. How to deal with bipolar disorder. These strategies can lessen disruptions in your life due to bipolar disorder. Using alcohol or non-prescription drugs changes the chemicals in the brain. This can worsen symptoms and make them more likely to return. Addressing symptoms early can prevent episodes from getting worse. Over time, you may have identified a pattern to your bipolar episodes and what triggers them. Share the warning signs and triggers you have identified with family, close friends and your healthcare team so they can better support you. Develop a specific plan and share how you would like them to cue you into your symptoms when you show signs of mania. They often can identify the behaviors and actions that signal a mania episode first and help you prevent your symptoms from reaching the highest level. Explore ways to create a sense of purpose by evaluating your values and beliefs. Identify what is important to you and set goals matching those ideals. The brain and body react similarly to positive or negative stress, which can trigger an episode. Consider keeping a daily journal or record of your feelings, mood and any activities that affect your stress level. Find a creative outlet or physical activity to channel your energy. Yoga or meditation can be helpful relaxation techniques. Sleep disturbance is a core symptom of bipolar disorder. Maintaining a consistent, scheduled sleep pattern with the same sleep-wake schedule daily is vital. Getting 7 to 9 hours of sleep per night is important. A work schedule that requires changing shift times can predispose a person with bipolar disorder to episodes. Therapy for bipolar disorder. Cognitive behavioral therapy is often used to treat people with bipolar disorder. There are two aspects to this type of therapy: the cognitive component, which helps to change how a person views a situation, and the behavioral component, which helps to change how a person reacts to the situation. Medications for bipolar disorder. Mood stabilizers are medicines that treat and prevent highs, mania, and lows, depression. They also help to keep your moods from interfering with work, school, or your social life. Examples include 1. Carbamazepine, Carbatrol, Epitol, Equetro, Tegretol. 2. Divalproex sodium, Depakote. 3. Lamotrigine, Lamictal. 4. Lithium. 5. Valproic acid, Depakene. Bipolar depression symptoms. Bipolar disorder is characterized by extreme mood swings. These can range from extreme highs, mania, to extreme lows, depression. Episodes of mania and depression often last for several days or longer. Depression. During a period of depression, your symptoms may include 1. Feeling sad, hopeless or irritable most of the time. 2. Lacking energy. 3. Difficulty concentrating and remembering things. 4. Loss of interest in everyday activities. 5. Feelings of emptiness or worthlessness. 6. Feelings of guilt and despair. Mania. The manic phase of bipolar disorder may include 1. Feeling very happy, elated or overjoyed. 2. Talking very quickly. 3. Feeling full of energy. 4. Feeling self-important. 5. Feeling full of great new ideas and having important plans. 6. Being easily distracted. Bipolar and borderline personality disorder. Borderline personality disorder, BPD, and bipolar disorder share some symptoms, such as depression and impulsive behavior. However, bipolar disorder involves extremely high or low moods, while BPD causes instability in self-image and mood. BPD is a type of personality disorder that causes people to feel, think, relate, and behave differently than people without the condition. Bipolar disorder is a type of mood disorder, which is a category of illnesses that can cause severe mood changes. People with BPD experience an ongoing cycle of varying self-image, moods, and behaviors. These patterns typically cause issues that affect a person's life and relationships and the way in which they understand and relate to others. If you are new at our channel, please subscribe our channel. It will be great support for us.